Dr. Alexander here again, and I have Cody, a mixed martial arts fighter who has suffered multiple injuries in the past. Today we're going to talk about his most recent injuries and how regenerative medicine may be able to help him. Cody, can you explain what's happened to you in terms of your pain conditions, generally speaking?
So, 31 years old, and I've had pain all my life, but I've also been an athlete all my life, and so you have the general wear and tear of playing football, wrestling, fighting, etc. And had an old injury. I was 17 years old when I tore my ACL, and just tore some other ligaments as well. And my fight on March 29th of 2019 this year. And I had the surgery April 22nd for a new ACL, reconstructive ACL surgery with a cadaver. And I'm walking around just fine. I'm just not able to jog or run because there's pain. They removed some articular cartilage, and I'm hoping that the stem cells will not only just give me extra lubrication in the joints, but would allow those connective tissues to grow back. So that's what I'm hoping for.
So the goal here is the main structural component that was causing the issue, his ACL being torn, has been surgically repaired. The goal of the stem cell treatment is to try to help essentially smooth out the rest of his knee. The cartilage that was lost, the parts of the ligaments that are not quite where they were ordinarily before you ever injured yourself, that's what we're trying to see get back for you. Now, I know that your right knee bothers you, but what about your left knee?
Well, I had the counterbalance, so my left knee was doing double duty since I was 17 years old. I'm 31 now, so I have a lot of pain on the outside of my left knee, a lot of pain on the inside as well. But I've had stress tests done from chiropractors on my left knee, and they said that I actually have better functionality forward and back on my right leg before the surgery than I do with my left leg. So my left leg gives more. So they said that you might have ACL damage in that left knee. I just haven't not had an MRI on that knee yet.
Understood. So what I can do for you today is actually an intra-articular injection of stem cells for both knees. The idea is that I can take the cells and put them at the source of the damaged tissue to allow them the greatest chance to rebuild those tissues. The way that we measure that, hopefully, is you're running, jogging, fighting, kicking everybody's butts, and living a normal life. MRI, CAT scan can be done at a future date, no more than 6 months, no sooner than 6 months from now, as a way to measure on imaging what type of growth is happening.
Okay, good.
Any questions about the procedure itself?
So you're saying 6 months is a good measurement to see how everything has developed. The only questions I have is when we get started.
Yeah. Let's do it now.
Let's do it now, buddy. Thank you.
Once I get the right spot, I'm numb there. Picture there. Here's some numbing medicine.
So this is just into the lateral medial joint space.
Correct. So when I do these injections blind, I actually go anterolateral. In a lot of cases, when patients have osteoarthritis, the medial compartment is worse. So coming laterally usually gives them better chance of success. But when I am doing them under fluoro, I go whichever side is going to be easiest for me to do. So right now, if I want to go lateral, I'm reaching across the knee. It's a little bit tougher, whereas over here, it's more straightforward. So I would hope here. Pictures.
Do you actually feel that pop into that space?
Yeah, you can feel like
Can you
a
feel a
difference.
little spot pop?
And in some patients, if they have really bad arthritis, you'll feel the calcifications of the capsule, and you can appreciate the difference.
You feel that mine?
No. Line. Stop.
Beautiful.
Picture. Picture. Image. Picture.
See, fill up.
actual medication here is going in.
Is that also the stem cells?
It is.
Yeah.
I live, like I said, I live in Connecticut, but I'm from a hot spring here.
Picture that.
Almost like you're Zealand here. Always.
So, I used to work with, I'm from Maryland. I live in Maryland. I'm originally from Buffalo.
And you said what you were doing this blind. How would you do it?
So when I do a blind, I actually have patients sitting, and then I hyperflex their knee, and I actually put my foot by their foot or my leg in front of the leg to keep their leg flexed, to keep their knee flexed. That lets that joint space open up, and by me blocking the area, it keeps them from kicking me and moving. Even if they don't kick me, if they move, it shrinks down that space. The other thing is when I have a patient sitting, I'm able to actually manipulate the knee a little bit better.
And everybody wants even more.
So what area? Right there. So it doesn't have a lot of infusion at all. So,
What's the history of this one? So he's 31 years old, MMA fighter, athlete all his life. He's injured both knees over time. Right ACL was torn about 6.5 months ago. Stats was repaired. Still with some, not fully recovered. Significantly less pain, but it's unable to tolerate his usual activity, which includes knocking out his back. Sure.
Yeah. Does anyone ever tore their knee? Doesn't feel good.
Never do so.
But I keep my spirit. I mean, I was rolling
it's
around
got
in a wheelchair. I
really
found my
serious
phone
muscle
afterwards.
tissue.
I'm like, dude, let's get a wheelchair. We're gonna fight in a wheelchair.
Do it again.
But once you put that in play, that's
You're crazy, man.
yeah.
All right, here's some numbing medicine here. So with ultrasound, the goal of whatever you're doing is to try to make sure that you visualize the structures and then visualize the needle. And so now that the area's been anesthetized, I want to make sure that as best as I can, I keep my target in sight and I keep the needle in view. It's a science and an art.
So in your hand, you just jiggle it a little bit, and you can see the tip. There's the tip.
Thank you.
And when you're there, you can just move the foot just a squish. Yes.
You can see the fibers better with the ultrasound than with the other.
Oh yeah. Well, you see soft tissues with ultrasound, and you see bony anatomy and joint space with LiDAR.
I like to see bone that's
Just so that you get a picture of what it looks like, I'm going to inject some contrast into the joint. Just so that we see the liquid movement. So you see how that's expanding?
So the needle's here, the joint space is right there. He doesn't have any major effusion in the joint space, so it's,
It looks good.
Yeah.
You check my brain?
And then I'll inject the rest like this. We'll do it.
so it's excellent. Done.
We made it.
Very nice.
Hello, my name is Cody Vidal. I am 31 years old, and I just had a procedure today on both of my knees. It was a stem cell injection. And the reason why I'm doing this is because I had ACL reconstructive surgery on my right leg, my right knee, and I have pain in my left knee, a lot of pain in my left knee as well. So on a scale of 1 to 10, I wouldn't even say the pain was 1 for the injection. Very easy procedure, quick, and hopefully very helpful.